Okay, so I'm going to talk to you right now about the three basic types of hearing loss that I come across in my profession. The first one is a sensorineural hearing loss, which is a permanent type of hearing loss, and that is when the cochlea, or the inner ear, that's where the organ of hearing begins by the nerve, has damage and it cannot be repaired through medical intervention. And that's the first type of hearing loss. The second type of hearing loss is called a conductive hearing loss. And for those of you with children, or those of you that have children who get constant ear infections or have had ear infections or PE tubes, a conductive hearing loss is typically a medically treatable hearing loss. And the most common example I can give you of a conductive hearing loss is when a child gets fluid in their ears. They are tested. The fluid that's trapped in the middle ear space causes a blockage of the delivery of sound to the hearing nerve. So we call it conductive because it's the conductive system that brings the sound to the cochlea. And that typically is medically treatable, as I said. A third type of hearing loss is a mixed hearing loss, or a combination of those two. Those are a little bit more difficult to diagnose because when you do your testing, you have to be very, very aware of the different characteristics of that hearing loss and what could have caused it with the patient. So again, there's three types of hearing loss. There's sensorineural, there's conductive, and then there's a mixed hearing loss.